For your Near Perfect Minute, I'm Dr. Jean-Marc Slack. A patient recently came in. She's in her 50s, went and saw a doctor who was concerned about her bone density. And that's certainly a concern that one should be aware of. It's a good thing to measure. But the recommendation was that she increase her calcium intake. Take Tums, take calcium supplements. It's really, really troubling because current scientific knowledge points to the fact that taking calcium might actually be adversely create adverse results for bone density and brittleness. Actually, a study published very recently in the Journal of Neurology looked at 700 elderly women, followed them for 5 years. A group took calcium, a group didn't take calcium. The group that took calcium supplements was actually 2 times more likely to have a fracture during the 5 years than the group that did not take calcium. Very, very counterintuitive, very much against what we've been taught in the public, in the lay media for decades. However, the scientific literature has really been strong on the fact that taking calcium supplements is not a good idea. Now, this study was published in the Journal of Neurology. What they were really looking for was the effect of calcium supplementation on dementia. Now, calcium and dementia, people taking the calcium supplement over 5 years, those elderly women, were 110% more likely to develop dementia than the women who did not take calcium supplements. Don't take calcium supplements. Calcium has an effect on cell membranes of the neurons, the brain cells, and it has a toxic effect. Now, one thing that is very protective for your neurons is magnesium. So if you have a choice of taking something, take magnesium. Actually, it's a good idea to take magnesium. So your tip for today, for this Near Perfect Minute, is do not take calcium supplements, but take magnesium supplements. Some combination might be okay of calcium and magnesium together. However, the magnesium component has to be there, and avoid the calcium supplement. Tums is certainly never an appropriate thing to do. For your Near Perfect Minute, I'm Dr. Jean-Marc Slack. See you soon.